Welcome to the episode Leadership in Public Health Management in our podcast series of Health Frontiers Insights from Global Experts. I am your host, Dr. Rishwata, currently pursuing MBA in Health Management. In this episode, we will dive deep into the intricacies of public health management with Professor Dr. Sonu Goyal sir. He is a professor of health management at PGIMER Chandigarh with 25 years of experience in community medicine and public health management. Welcome to the show, sir.
Thank you, Ishwita.
So my first question to you is that with 25 years of experience in community medicine and public health, what motivated you to pursue management and leadership as your career?
Thank you, Ishwita, for asking this very important question, because I graduated way back in 1998. I did my medical graduation from Shimla, a hilly town in India, in northern part of India. And during my undergraduation days, I used to see many patients when we used to go for clinical postings. So we used to see patients. We used to see doctors there, and we used to see how much work these doctors used to do. And despite the end of the day, when I was interacting with them, they are not satisfied because they say that we could not do the task optimally, or we don't have resources in the hospital. How can I manage? We don't have drug, we don't have instruments. Surgeon used to say that all the things which I need are not there. And then there are lack of teamwork between nurses, doctors. So all these problems were there. And I used to see that we have 5.5 years of our undergrad medical graduation, and we are not able to manage the resources, whether it is human resources, whether it is supplies, whether it is drugs and all those things. And we are not taught about those soft skills like team building, leadership, communication. And that was the initial thing which started in my mind, that I need to do something on that. And when I did my post-graduation, completed my post-graduation, I joined UNICEF there. And in that also, I find the same thing. But here I find the similar thing with the managers, those who are actually managing the programs. I find the same thing. There was lack of teamwork, lack of communication between these things. And that thing suffered, the program suffered because of these things, not because of their technical expertise. They are very good technically. So then I thought of pursuing my career in this management. And I appeared for an interview for my PGI for assistant professor in 2008. And luckily I was selected for the faculty of health management. I designed some courses on health management. There was no discipline. And still in India, we don't have many courses on health management. I designed courses for our MD students, for our Masters of Public Health students on leadership and management. And then I thought about, after 7 or 8 years of incubation time, I thought about why not to design the same type of programs in the global context. Because now we have done so much of hard work designing this program for students. So why not for the global audience? And then I thought about having this International Public Health Management Development Program. I started with this program, having the basic principles, a 5-day course for this program, and then it became an international arena. So my basic premise was that doctors, nurses, health workers, and all people who are working in the health sector are very good technically, because they are given very good technical knowledge in their courses, but they lack leadership skills, they lack management skills because of the fact that they are not being taught in their curriculum. They just experience from their experience. So that led me to design the special courses on management and leadership.
Thank you, sir. That was very motivating. So, Dr. Goyal, you are a very well-known face, not only in India, but also globally. And you have conceptualized IPHMDP, and that is a flagship program. and you have trained over 1,300 plus people from 90 countries. Why do you think leadership and management program is important for people working in various national health programs?
Right. So as I told that in various programs which people used to come to us from different countries, they face the similar challenge. And these ITech countries are the countries which have a very similar setup as our country, India. So we don't have leadership and management programs in most of the countries. So we have these programs, some programs in Western setup, but these Western setup programs are not actually applicable for us. When we go there, we learn, but we can't replicate because we have limited resources. So that made me thought about having our own program for our own people, South-South collaboration, and there the Ministry of External Affairs chipped in. They requested us to conduct a program. Initially, it was just one program a year, but now it has proliferated in such a way that we conduct 5 to 6 programs in a year. And there is a lot of demand for this program. Every time we receive applications for many people who want to come and who want to learn as comparison to other programs, other iTech programs. So that initially we have our flagship program, that is International Public Health Management Development Program. Then we started Public Health Policy and Management Program for senior level managers. Then we started our specialized program for country, because some country also approached us for the program for their own country. So we have conducted program for Nepal, we have conducted program for Myanmar and Maldives as well. So these are how these program has proliferated, because there is a felt need. People who are public health managers, they need how to plan the resources, how to prioritize resources, how to do budgeting, how to do resource allocation, how to effectively coordinate, how to build a good team, how to communicate with people. So all these skills and motivation, all these skills are very important. So this is how we used to have this program as a capsule in this international public health management program.
Sir, you have worked with countries in North like Netherlands, UK, US. So, what is the difference you feel is there between the South that you talk about and the North?
One, the important difference is the resources, because in all countries, including India, Southeast Asia, Africa, South America, so all these countries have less resources as compared to their problems. So their problems are huge, but resources are less as comparison to the developed nation, where they have ample resources. So their programs cannot be a good fit for our people. Number one. Number two are the problems. We have a different subsets of problems. We have communicable disease. Now there's a dual burden of the disease, communicable and non-communicable diseases. We have some diseases which have disappeared earlier but have come now, the emerging and re-emerging diseases. So all these things are there in our country, which is less in the developed nation. The third thing is like the type of resource people and the resource pool which is there, which is different from our country as compared to developed. So there is a huge difference in the setup, in the infrastructure, in the human resource, in the supplies. So that's why the programs need to be different from those countries.
So, sir, conducting these sessions, what were the challenges you faced in South? Like you studied from North and now you have come to South. What are the challenges you faced?
Yeah, so basically, when I am a resource person for some of the programs which are there in other countries as well. You name the country, so I teach leadership and management there as well. I used to learn from their programs as well. So I take some good things from those programs. I replicate this in these programs. But I find initially I found various challenges. The number one challenge was I am a public health professional. And many people in public health are not aware what health management is, what leadership is. They are morely concise with epidemiology or health promotion or other aspects. So it was initially very difficult to convince people that health management is a discipline in itself. So when we conducted first program, so one of my program coordinator used to tell me that, yes, sir, do you feel this program will be successful, or do you feel that you have many takers for this program? I initially thought, and that I responded to her that I feel that, but in case we could not find the takers for this program, we will have a case study, and that an unsuccessful case study will be there, and we'll publish that case study. No fun about that. So at least the people who are designing the future program will come to know about this fact. So this was the initial problem, but luckily we have lot many candidature in the first program. We have almost 100 plus people who applied, and we selected 30 people from 30, I think 28 states. So I think it was a huge mix-up. This was the first challenge. The second challenge was that people have a notion in their mind that they learn leadership from their experience. That's a very strong notion. The senior people doesn't want to learn leadership and management, right? So initially, but then when I applied, when we publicized this program, I'm happy to inform you that 5 head of the department of top institution, that is All India Institute of Medical Sciences, they came as a participant to this program. This means it was just a notion, but they want to learn leadership and management. And the third thing which we have is we have a different mindset. Mindset not only in terms of resource people, but mindset in terms of the participants as well. Why to spend so much of money attending such program which we can learn at home? Some people say that leaders are born, so I can't be a leader because leaders are born. Manager, I can't inculcate at this stage. I can't add upon to my skills more. So that was the initial challenges, but we overcome those challenges, and now we have this program. We have 26 program, 1,300 plus participants, and when we see their profile, they come from the age of, say, from 25 years till, I think, we kept the age at 45, but some people have requested that beyond 45 also we should have that participation. So we have a huge mix of participants now.
I totally agree with you. Even after doing BDS, people used to ask me, what is health management? Why are you going towards health management? There's no career in it. And I'm like, no, there is career in it. You just don't know about it.
Exactly.
So as an educator, how do you prepare the next generation of public health professionals like myself to incorporate leadership principles into their leadership roles?
Exactly, because this is what I am aiming for, because ultimately, I want to start leadership trainings right from the start, right from the career. So I have advocated in various meetings, forums, and at high-level meetings as well, that in our undergrad curriculum and the postgraduate curriculum, we should have some leadership lessons incorporated into it. And now our Medical Council of India have that thing inbuilt when a fresher comes. So this team building, communication, lectures, and some role plays are there for them. So this is number one. Number two is not only theoretical lectures, but when they go for their field postings, when they go for community posting, when they go for their clinical posting, they should be asked to demonstrate leadership skills, and there should be a checklist for it. They should be assessed for assessing leadership. Like, for example, for a case management, we take a case of cardiac disease. Yes, so there is a checklist that how you have performed in a case. Similarly, when you are being assessed for that, you should be assessed for showing empathy. You should be assessed for your communication, how you are communicated with the patient, how you communicated with the nurse manager. So these things are lacking, and we need to incorporate those things, and which we are trying to do. And the third thing is having career. As you are rightly told, now you have many people who are doing PhD in health management, PhD in leadership, and we have various institutions which are engaging them. Even now we have MBA in health management, which are there, and you yourself are enrolled into it. And now we need to build our contextual courses where health scenario, although we have an MBA in healthcare, but we need to involve the example, case studies, games into that forum. Because these things, if we keep on telling to the higher level people, so through lectures, it is not going to be good. We need to introduce some new things. So we, in IPHMDP, which I'm talking about, we have an approach of gamification. Yes. So we introduce games, and people learn from games. So there is nothing better than learning from games and stories. I always believe that two things we are very good, because now we are fond of listening stories in our childhood days. So even now, if somebody start telling me the story, I am engaged, right? So I always believe that games and stories are two important medium to actually educate.
Sir, my next question is highlight the importance of management and leadership programs from a clinician and public health point of view. As people think that epidemiology and health promotion are the only important subjects from public health point of view.
Yeah, so as I told that for a clinician, it is very important. Many clinicians who have come here in our program, and when they went back, they told that, yes, Dr. Goel, I started using the principle. I knew about team building. I knew about communication. It was not a new thing, but I knew certain things from the course which I inculcated. And now we have a better team building. We have better communication. My workers are motivated. I use some principles of motivation taken from your course. Yes. I used to have the same games with my people back out there. Yes. So they learned some of the skills from this program, and they were quite successful. So clinicians are a very good people who need to learn these courses for their optimal functioning, because they are very good technically, as I said, but when it comes to leadership and management, we need to educate them on that as well.
So, sir, I have one question more. You talked about, you have many stories about tackling difficult people in an organization. I would like to hear one from you.
Yes, so I think I'll tell you one story on this. One of when I was doing my residency after my post-graduation, at that point of time, there was a person, I'll not name that person right now, but there was a person who was very tough. Previously, even the faculty, it was very tough to get the things work out of him, right? But he was very good in making relations. So he's always out. He comes at 10 o'clock, 11 o'clock, and he always tried to disturb people who are doing the work. So he always say, why you are doing work? So I'm free and nobody objects me. And previously somebody has had a complaint about him, but he has some good relations, so he was back. So he was even more confident that nobody can do anything for me. So I was a resident at that point of time, and then I just observe initially what are various strengths of various people. So when I just observed him, so I observed that he also had some strengths, and he had a strength of networking people. So what I did is, I always assigned him some job which required networking, and there were a lot of jobs for networking. Like for example, our health center doesn't have a good seating arrangement. Chairs were not good, table were not good. We didn't have BP apparatus, which is very good. So I told him that, can you call the head of this village or head of this slum and various other stakeholders who can contribute. So he was very happy. Yes, I know many people. I will call people from different this thing. And he called a meeting, and I presided that meeting, in which I requested people, that those who can contribute. And he had that good rapport with those people. So if the people told that, yes, we are happy to contribute to this health center, and we got a very good chairs, we got good tables, we got good weighing machine, and all apparatus. And similarly, I tried to involve him in community meetings when we want to give lectures on various common diseases as a community. So he used to call people. So I engaged him, seeing his strengths. Every person has strengths. So we need to recognize that each person has their strengths which we need to harness. We are not able to recognize that.
So the takeaway from this is that a good leader knows how to recognize people and their strengths.
Exactly.
Thank you. Thank you so much, sir, for today. Thank you, sir, for sharing your insights and experiences with us today. It's truly enlightening experience for us. And thank you. And to our listeners, thank you all for tuning in into Leadership in Public Health. Stay tuned for more episodes, and where we bring you the latest in public health management. Until next time, stay healthy and stay informed. Thank you.